Zenaida's tuberculosis story. What did you know about tuberculosis before your diagnosis?
Before I knew I had tuberculosis, well, I first came to this country in 2017. I was working with my parents in the strawberry fields, and that's when my throat started to hurt. At first, it started to get scratchy, and when I would breathe, my chest would hurt. I couldn't work where I worked anymore because my chest started to hurt a lot when I would breathe. My chest would hurt a lot here. I couldn't even eat, but my parents said that it was just a cold. A cold is what my parents had told me. I didn't go soon enough to know that what I had was tuberculosis.
Tell us your tuberculosis story. Where were you first diagnosed? Did you feel unwell at that time and this prompted you to seek medical attention?
When I found out I had tuberculosis, I no longer went to work. I told my parents that it was because my chest was hurting a lot, and with my hand, I could no longer do this with my hand. My hand went this way, and I couldn't hold things with it. My parents took me to the community health center on Blosser. That's where the doctors checked me and examined me. They drew some blood, and they were the ones who told me I have tuberculosis.
When you were first diagnosed with tuberculosis, what was your reaction?
It was 2018 when they told me that I had tuberculosis. I was scared because I didn't know what would happen. A family member of mine had tuberculosis in the state of Guerrero. That is where my aunt had this. I had no idea what it was, and my family would just say it's something bad. It's just a dry cough, and there is no medicine that is given to cure it. They also didn't finish all the medicine. When I first got here, I wasn't sick, but then as time went by in 2018, I started feeling sick.
What was your tuberculosis treatment journey like? Were you scared or did you have any worries?
When I first started taking the medication, they told me that I couldn't stay with my parents. They gave me a room where I could stay, and I would stay alone because my parents couldn't stay with me. For 2.5 months, I lived alone in a room that was provided by the public health tuberculosis care team. I started taking the medicine, and the nurses helped me because at the beginning I was scared. I thought I wouldn't get better. I did get better. They treated me nicely and talked to me about how I would take the medicine. They helped and took care of me.
How did you feel after completing your tuberculosis treatment?
When I finished taking the medicine, I was really happy because I wasn't sick anymore. That same year, in 2018, I was pregnant. Even though I was pregnant, I was still taking the medication because it was helping me, and the nurses helped me take it. We need to take the medication for our own good and to be with our family. When we are sick, we cannot be with them. We can be contagious and give the sickness to our family, our household, our kids, elderly ones. We can be contagious to them. That's why when I finished with my treatment, I was happy because I knew that I was going to be cured.
How would you describe your experience with our tuberculosis healthcare team here at County Health?
What they did for me, I believe they helped me. They really helped me. About 3 or 4 nurses would go check on me and make sure that I was taking the medication. When I was sick with tuberculosis, they helped me, and that was a good thing. They were very helpful.
Can you share a time when our healthcare team made a positive difference in your journey towards healing from tuberculosis?
During that time, they only did good things and helped me, and I was happy with that. They treated me good. There was not a moment that they went to see me and treated me in a bad way. They helped me even though I was scared to take the medication and I was scared of being alone. But when they would give me my medicine, They would talk to me and they would tell me that I will get better soon. That is what they would say to me, and I would feel happy. I took all the medication and listened to them.
Is there anything you wish our healthcare team had done differently or changed in your tuberculosis care?
For me personally, there is no change that needs to be made. Everything was good. For all those that have been diagnosed with tuberculosis, take the medication because this will help you be with your family. If you don't take the medication, it will be bad because all they want is for us to be healthy. They take care of us and want us to be with our family. For me, it is good because it is medicine, medicine that will help us. Since 2018, I started taking the medicine and it helped me feel better. I finished taking it in June of 2019. It helped me.
Would you encourage other community members to contact the county health team if they're in a similar situation? And finally, what is something you wish more people knew about tuberculosis?
What I want is for those that have been diagnosed or were checked for tuberculosis to look for help in county health because they will help you. That way, we will be cured. They will give you the medicine that you need to get better and be with your family because it is good medicine that they give. They helped me with everything. They helped me when I first came and could no longer work with my parents. They help us. They aren't just anybody. We may think that they are going to trick us or aren't telling the truth, but no, they want to help us get better.
Thank you for watching. For more information, please call the Disease Control Program at 805 681 5280.